Guides can break. I don't have an example of a single unit guide picture being broken, but this is a full art surgery, and as we know, every part of the surgery is dependent on the guided aspect before. So, for example, if we plan a certain bone reduction with pins and everything after that is associated to the first steps of it, if one part of your surgery breaks or doesn't work, everything down the line, it's a downstream effect. Everything downstream of that part isn't going to fit anymore. So we like to have backups. If you have no backups, these guides are repairable. For example, this one was designed a little bit wimpy. As you can see right over here, that's some core buildup material. So guides are printed out of resin. Our temporaries are printed out of resin. Guess what? Resin is used all the time by us with core buildup, flowable. All that stuff can temporarily bind and fix some of these areas. Think of it as like a dental super glue. So I've repaired a few guides before with using flowable around little tubes that connect the guide tubes. And if you are worried about this happening, especially during the first few surgeries that you do, print 2 guides. It's not going to take you that much more resin, especially if you're worried about distal extensions, anything popping off. So better be safe than sorry. Measure it twice, cut once. It's all the same concept. And also, just like Matt said before, it's recommended that if you haven't done a lot of implants, don't jump right into saying, hey, guided is the key to fix everything. Know how to bail yourself out, know how to place freehand, know how the bone feels, because sometimes you place an implant guide into a planned area, you have no bone there, even though the CBCT shows you have adequate dense type 2 bone. Sometimes you have to switch the placement, sometimes you have to bail yourself out. It's actually a video. So that's going into the repaired section, and you can see it holds up pretty well.